Hello and welcome to the second video in our series about ClinDoc. In this video, I will cover the basic functionality within a template when creating a note. Let's go ahead and get started. As you can see, I have already searched for and opened my template that I want to work on today. As you can see off here to the left side, that is where I'm going to do all my work to choose and text in what it is that I need to fill out for my patient. Most of the fields look similar to what we're used to. I have text fields that I can text into. I have choices called clickable text that if I click on, it will be my choice that I am charting. I have fields that go ahead and auto-populate information if it's entered in by other people within the hospital. I have the ability that I can add narrative notes on any of these fields. This little television looking thing, if you click on it, you're able to add a narrative note and type in whatever you need to. As I am composing my note on the left side of the screen, I can change the right side of the screen to show me exactly what it is that my note is looking like. For me to do that, I go to my Preview tab, and now I can see exactly how my note is being laid out on the page. On my Review of Systems, I see that I have a negative statement next to my Review of Systems, so if I click that, it shows me that a complete review of system was performed in negative. I can then come down through here and choose other options if I need to. I have my narrative boxes that I can narrate something into if I need to. For example, for our review of systems, I have my negative statement, but then for my physical exam, I have a within normal limits statement. So if I want to go to my physical exam section next, of course I can scroll down and find it, but a quicker way for all of us at the beginning may be to go up here to the Go To section and click on this down arrow. From the down arrow, I can quickly find what it is I want to go to next and click on it and find it. By clicking on the within normal limits statement next to my physical exam, it will choose what has been defined as normal for this template. If there is something that maybe I didn't assess, I can unclick it. If there's something that I have found as an abnormal, I can click the No. It will ask me additional questions if I want to answer them. Or I always have the opportunity that I can put in text into the narrative field. Off here on the right side of the screen, I can see exactly how my template is being laid out now, with all my normal statements being generated. As you can see off here on the right side of the screen, I have my auto-populated fields that come in automatically, and we're used to that from our current charting system. But if there is something that is displaying that maybe I see it as false information, maybe it's not true, I don't want to include it into this template that I am creating, I can get rid of that section. And this is how I do that. I find the section that it is that I want to get rid of. I go off here to the right side of the screen to the dot, 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 dot. Now, if I wanted to correct that information, I could do that from the Manage. But if I want to remove it completely from this template, not future templates, I can click on the Remove. When I click on that, it's essentially asking me, once you do this, we can't bring it back. Are you sure that you want to continue on with this process? When I click Continue on that, then I can see that that alcohol section has been removed. Now, I am in my history and physical for this patient, and this template does not automatically pull in labs, but I have the opportunity that I can pull in individual labs if I want to, or if I have any template open, I can do this. So how I pull in some labs to my note is I come over here to the right side of my screen. Off here to the right from my preview tab is my results tab. On my results tab, I can choose labs to view if I want to. If I want to include some in my note, I just make sure that there is a checkbox next to that field. And then I'm going to come down here to the bottom right hand part of my screen, hover over the include in note, and I'm going to choose where it is that I want that to include into my note. Now I can see here's my labs. I can do that same process for imaging studies. I can choose my imaging study that I want to include in my note, hover over include in note, and then it populates into my note. Another option that we have in ClinDoc is to include orders. So you can choose any active orders that are on your patient within your filter time, and you can choose them to display into your note. I also have the ability to pull in notes from that's previously been completed. If I click on prior notes, and then I find the note that it is that I want to borrow information from, I double click on it, find the area that I want to, of the information that I want to copy, highlight, right click, copy, click into the field that I want it to go into, and hit Control V. And then my information is displayed over here. I can copy, I can change it, I can edit it, I can do whatever it is that I want to at this point to my information. Now, I have the ability that I can also go to medical records from this note itself. I can do that from clicking on this H right here. Okay. I can also do the same process that I'm always used to right now, is go into the medical records tab as well. Now, if you get called away within the middle of the note, or you're not wanting to complete the note at the present, you can save your note. Okay. After it saves, I wish this said close, but it doesn't. It says cancel. Think of it more as a close button and then a cancel in this situation. So I'm going to click cancel. And then I see that here is my unsigned note. I can go off, do whatever I need to, come back to it when I want to. When I come back to it to open it back up, I just double click on it. And here is my note. I can bring back that preview screen if I want to by clicking on the preview. I can add to it. While I have this note open, I can review anything else in my patient's chart. I can go to my Overview tab. I can look at orders. I can place orders. I can go to my Flowsheet tab. But when I go back to my document that I have open, it will be there saved with all of my changes that I just made. When I'm done with this note, all I need to do is click on the sign. If I'm the attending physician, I would be completed with that task. Of course, if I was a mid-level nurse practitioner, PA, I would have to designate at that time who is the attending physician to sign my note off. This concludes our session for today. Thank you very much.